Welcome to part 2 of our NCLEX Maternity Nursing Practice Test. If you thought the first one was very challenging, this set will push you even further. We're going to deal with key concepts. Like I said, these are mini series. They are key concepts for your NCLEX or nursing school. I'm going to push you. We're going to do some calculation, but focus on the concept, and you can use it to answer any question. NCLEX practice question, maternity series. First question, what am I trying to teach you? Which teaching is most important for the nurse to provide? A client at 14 weeks gestation as a cervical cerclage placed. The concept is what? Cerclage. Every question, try to underline one key fact. But what is that? Cerclage place. Which teaching is most important for the nurse to provide? Report pelvic pressure or contraction immediately. Resume normal activities after discharge. Expect heavy vaginal bleeding for 1 week. Sexual intercourse is encouraged daily. What do you think? Cerclage. The content is cerclage. Go back to the content. What is cerclage? Cerclage is needed when the individual has incompetent cervix. Therefore, the cervix usually is supposed to hold the baby until it's ready to dilate and effaced, and the baby come out. Some women, the cervix are usually incompetent. So during the first trimester, before they get to the second trimester, early trimester, second trimester, the cervix dilate, they go into preterm labor, and the baby come out. Spontaneous abortion. Therefore, we place a suture there to prevent the cervix from opening. We call it cerclage. What do you think? Based on the content, what do you think you should provide the mother? Do you want them to have intercourse? Do you teach them that there's going to be a vaginal bleeding for almost a week? Resume their normal activity, or when they see pressure or they feel pressure, contraction, immediately they should report it to you. If they go in labor, they should let you know. Which answer choice tells you that the patient is in labor? These are concepts you got to write down and then master them. Sexual intercourse is going to cause problem. If you're bleeding for a week, you may be having complication. You should slow down. And therefore, your best answer is to call me when there is signs of labor. Pelvic pressure and contraction is not good. And that is the concept you should pay attention to. That's the concept. That's the concept you should pay attention to. So when you see a question, think about having labor as one of the things they should let you know. Therefore, we tell them to come in early before they go into labor. Signs of preterm labor or rupture must be reported as soon as possible. First question. A client who was at what? Pre-pregnancy BMI of 25. This, most people may not know how to calculate. This is a hard question, but it's not hard. I'll give you concept, write it down. When you see a question somewhere, adapting class catch you. She's at BMI 25. Now, 20 weeks, right? Pregnant, and has what? Gained what? 9 pounds. What does that mean? Pre-pregnancy BMI was 25, and she's now 20 weeks and has gained what? And has gained 9 pounds. Which interpretation is most appropriate? The weight gain is excessive for 20 weeks old. This weight gain is appropriate for gestation age. This weight gain indicates a risk for what? Intrauterine growth retardation. That means the baby is not growing. This weight gain shows a need for bed rest and fluid restriction. What is the concept I want you to take with this question? If you don't know, remember it and write it down. Whenever you're at first trimester, everybody, no matter your BMI, you're going to gain 1.1 to 4.4 pounds. Everybody is going to gain this, whether you are overweight, underweight, obese. At 25, she's overweight, slightly overweight. 24.9 is normal BMI. So it does not matter. After the end of the first trimester, she can gain a maximum of 4.4. So we will assume when you're doing calculation, assume she gained the maximum 4.4. Then 20 weeks, 8 weeks is left. That means 12 weeks is the first trimester. We're taking 12 weeks as the first end of first trimester. And therefore, 8 weeks, she has 8 weeks left. Because she's overweight, she's going to gain 0.6 pounds every week. So for 8 weeks, she's going to gain this. This will be close to 4.8 pounds, right? So this is what she will gain, 4.8 pounds, because 0.6 is times 8 is 4.8. And therefore, what do you think? 4.8 time plus 4.4, this is 9.2. So a total of 9.2 pounds she's supposed to gain in addition to a original weight. What did the question say? She gained 9 pounds. Therefore, the weight gain is not excessive. The weight gain is appropriate. The weight gain does not indicate intrauterine growth retardation. The weight gain shows a need for bed rest. It does not. So this is the concept I want you to take with you, that weight is based on what your BMI is before. At 25 weight, gain 4.4 pounds first trimester, and then at the end, she's going to gain 0.6 pounds every week until the end of her pregnancy. And so this is key that you're supposed to know, and that is appropriate weight gain. Which vaccine is safe for a client at 26 weeks gestation? Write it down. I need to know vaccination for pregnant patient. It's a key concept. Every question, that's the buzzword, that's the trap, that's the NCLEX content you have to take with this video. Therefore, ask yourself which one is live and which one is non-live, because the pregnant lady should not take live vaccine. MMR, varicella, Tdap, and a nasal flu. Know this, write them down. These are your live vaccine, right? These are your live vaccine. Varicella is a live vaccine. Nasal flu is a live vaccine, but IM form is not, right? MMR is also live vaccine. They are not safe in pregnancy. Tdap is good. If you give the lady inactivated flu, which is the IM, it should be fine. Therefore, the right answer is a Tdap. She's going to get a Tdap, and she's not going to get MMR, varicella, and nasal flu. I know you're getting the concept. You see what I'm trying to do. I'm not going to give you really complicated lecture, but I'm using this to show you the concept you're supposed to memorize. And I know, and I want you to write them. I need to know vaccines and how they give it to pregnant patient. I need to know live versus unlive. That's all. That's the concept number 3. The next question, this is the hardest of all, but don't worry. If you are in a nursing school watching this, I want you to take a note. If you're preparing for the NCLEX, also take a note. Those calculations are strategy. There's a strategy to tackle it. How many ml per hour should the pump be programmed to deliver? The provider prescribed Pitocin 20 units in 1,000 ml per liter to be infused at what? 12 milliunits per minute. The nurse will use the pump at which rate? Don't worry, I got you. Every time you see a dose calculation, go to the answer choice. What is that? ml per hour. Write it down. I need to do ml per hour. And that's all. As soon as you do that, all you need to do is whatever they've given you, flip them back and forth to get into this shape. I see ml here, and I see 20 units. Therefore, 1,000 ml need to go up. 1,000 ml over 20 units. That's the first thing. And since this is a milliunit, I need to convert the unit into milliunit. Therefore, I have 1 unit over what? 1,000 milliunits. Now, I bring my milliunit 12 milliunit over minute. I need to have hours. So I convert the minute into what? 60 minutes into 1 hour. You done. Cancel everything. Unit cancel unit. Milli-unit cancel milli-unit. Minute cancel minute. And you have hour down, you have ml. And the thousand cancel thousand. What is this? 60 and 20? This would be 3. Therefore, you have what? 36 ml per hour. Number 1 is our right answer. This is the key in answering those calculations. But this is another way to do that. Always convert the units so that they are the same into milli-units. Then because most of the infusion will be in the milli-unit, then convert the milli-unit into hour. So that's what we do. We convert the unit into milli-unit and then milli-unit into hour by bringing our time. This is those calculations with Pitocin. And this is a nursing school NCLEX question you may see. This is the next question. An 18-year-old client with the history of Marfan syndrome is pregnant. What is the nurse priority teaching? You are at risk for aortic rupture during pregnancy and delivery. You will need additional screening for gestational diabetes. Your baby will likely be large for gestational age. Oral contraceptives are recommended postpartum. Why do I give you this question? Because I want you to know this concept about Marfan syndrome and pregnancy and why at this age they have connective tissue disease. So their aorta is not that strong. The connective tissue, there's a problem with collagen issue, and therefore they have dissection of the aorta. They will get dissection of the aorta, and because of that, we teach them that you should not get pregnant. But if you want to get pregnant, you should do that at early age when you're stronger. That's why 18-year-old is pregnant. But what is the priority action? Of course, we're going to prevent you from getting pregnant, giving you oral contraception. It has nothing to do with gestational diabetes, right? Your baby is not going to get bigger. We don't need to screen you for diabetes either. But the biggest problem of these patients is aortic rupture during pregnancy and delivery. And therefore, that should be what the nurse should prioritize so that when they're ready to deliver, they have everybody available to help it. Therefore, number 1 is the right answer. Aortic rupture and dissection risk is the major concern in pregnancy with Marfan syndrome. This is the key that you have to pay attention to for that question. Number 6, what is the key here? A client 1 week postpartum, 1 week exhibit what? Hallucination and disorganized behavior. What do you think? Stop the video. Answer the question. Let me know what you think. What is the priority intervention? Refer to a support group, schedule outpatient counseling, initiate antipsychotic therapy and hospitalization, provide reassurance that symptoms will resolve. What do you think? This patient, is it postpartum blue? That was the purpose of the question. It is postpartum depression? That was the purpose of this question. Is this postpartum psychosis? That is the purpose of the question. The presence of hallucination and disorganized thought means what? Means what? You know it. You know your mental health. Bring it together. Hallucination, disorganized thought process. This is consistent with psychosis. When you have postpartum psychosis, the management is what? Inpatient rehabilitation and antipsychotic. Refer to support group is designed for probably blue. Schedule outpatient counseling, also blue, and depression. Initiate antipsychotic therapy and hospitalization consistent with psychosis. Provide reassurance that the symptoms resolve. They are not going to resolve. They need rehabilitation, inpatient, and psychosis. Therefore, what is your right answer? As we said, underline it and you pay attention to it. Hospitalization, antipsychotic. Number 3 is the right answer. Number 7, and this is the key. Postpartum psychosis is a medical emergency. Hospitalization and antipsychotic are your key. A client with gestational hypertension, she has hypertension, not preeclampsia. Pay attention to it. Which prescription should the nurse anticipate? Right? Select or apply. Labetalol, magnesium, daily blood pressure monitoring, fluid restriction, immediate what? Oxytocin induction. Stop the video, put down your answer. Let me know what you think. Let me know which one is affecting you. Think about it. I hope you're writing the concept down. There's a concept question here that you have to know. Maternity, NCLEX practice question, and NCLEX answers, questions and answers. Maternity nursing concept for the NCLEX and nursing school. That's what we're talking about in the mini series of practice tests. The key is what? Gestational hypertension. You have to know the difference, right? If you have hypertension before 20 weeks and you're pregnant, right? That is what? Chronic hypertension. If you have hypertension after 20 weeks, you have what? What we call gestational hypertension. If you have associated neurological symptoms, you have something we call pre-eclampsia. And you have seizures, you have eclampsia. In this situation, she has gestational hypertension. We want to prevent it from going pre-eclampsia. So definitely, we're going to give a blood pressure medication, leave it or not. Definitely, we may have to give a seizure prophylaxis. That is what magnesium is going to do, right? Definitely, we're going to monitor your blood pressure daily to prevent it from getting into trouble. We're not going to fluid restrict her, and we're not going to provide Pitocin. There's no indication for the baby to come out. So this and that are some expectation the nurse should expect from the doctor will be ordered. So antihypertensive is number one. Seizure prophylaxis, right? And then monitor your blood pressure so that it doesn't develop. What is the next priority action? A client receiving Pitocin for labor induction develop what? Recurrent late deceleration on the fetal monitor. Pitocin stopped. We already stopped it. What is the next priority action? Do you call the doctor? Do you start IV? You apply oxygen or place the client on the side? This is a concept you have to know. In case you take the NCLEX and you see that, we have what? Recurrent lady cell. If you write VCHOP mind, you will figure out that, oh, that this is the problem, right? If you write it and then you remember it, we have recurrent late deceleration, which is consistent with placenta insufficiency. That means something is wrong. There's no blood flow from the placenta. And therefore, what we do is lie on. After we stop the poison, we have stopped the poison. The first thing you do is your lion. That's what the question is saying. I need to stop the poison. I stop the poison. Next thing, do you call the doctor? IV fluid, oxygen, or place the client on the lateral position? You can see based on the lion, lateral position is the right answer. So number 4 is the right answer. And that is the purpose of this question, to let you pay attention to the order of treatment. It's very important. So lady cell is placenta insufficiency. First action, stop Pitocin. But then after that, focus on what? The lion, which is what? Lateral position in this patient. What is the next priority action? A client memory rupture spontaneously during active labor. What should you worry about? When your memory rupture, do you document the time it happened? The word said priority. When your memory rupture, do you assess the fetal heart rate? The word said priority. When your memory rupture, do you note the color and the order of the fluid? The word said priority. Monitor the client contraction. The word said priority. What do you think? When your memory rupture, all the fluid comes out and the placenta comes with it, you can have what? Cord prolapse. And therefore, how would you know the baby will have deceleration? So you check the monitor, but you want to make sure there is no cord prolapse. How do you assess it? You do vaginal exams and see if there's cord prolapse, or you look for the fetal heart rate on the monitor. What do you think is your right answer? Documenting the time is okay. Checking the color and the order is okay. Monitor the contraction is okay. But the word priority, I got to look at the baby. Is the baby decelerating? then I need to do something. Number 2 is the right answer. Therefore, after a rupture of memory, priority is to assess fetal heart and look for cord prolapse. Last question. I know you got it. Put it down. Let me know. The client at 28 weeks has a 1 hour 50-gram oral glucose tolerance test of 142. What do you want to do? Document this as normal, schedule the patient for 3-hour test, notify the provider for hypoglycemia, repeat the test immediately. Random 1 hour 50 oral glucose test is a screening test. When you screen it, it tells you whether the patient needs additional tests or they don't need any additional tests. 140 is your magic. If you're less than 140, you're good. But if you're greater than 140, we have a problem. 142, we have a problem. Therefore, what do you want to do? We got to do more tests. What kind of tests we have to do? Mommy has to fast. So we got to do 3-hour fasting tests. And that is the right answer. Documenting this as normal is wrong answer. Notify the provider of hypoglycemia. No, we got to look and make sure we test again. Repeat the test immediately. No, because we got to fast. Therefore, number 2 is your right answer. 10 questions are yield, critical thinking, maternity, nursing, NCLEX practice question, test taking strategy for you to master your NCLEX and nursing school. Thank you for your time. Good luck